Welcome back to Get the Facts. We're talking about prostate cancer as we observe Prostate Cancer Awareness Month. And our guest is Dr. Jeremey Thomas. Doc, tell us, what are the treatment options for prostate cancer?
Okay, so the treatment options for prostate cancer, well, first it depends on the stage and the grade of the cancer. So, roughly speaking, or for just general knowledge, it's divided into whether it's organ confined or whether it's locally advanced disease or whether it's metastatic disease. The options vary for each stage, or as I've mentioned.
Yes.
So for organ confined disease, which is disease that's just confined to
To
the
the prostate.
prostate, it's absolutely curable. The two major options that exist are surgery, which is where I come in, and where urologists come in. And what we offer is a radical prostatectomy, which involves making a small incision, or I shouldn't say a small incision, an incision to the bottom of the abdomen. We get access to the prostate there, and it's actually removed, and then the bladder is reattached to the tube through which you pass your urine. Sometimes we take pelvic lymph nodes, which are, what Jamaicans would call wax and canal, but some of the first areas that prostate cancer can spread to, depending on the risk from the biopsy. And that's taken along with the specimen, and it helps us to properly stage the cancer. The other option for organ confined disease is done by our colleagues, the radiation oncologists. There are several methods. They can do external beam radiotherapy. There's also 3D conformational radiotherapy. And for smaller prostates, there's also brachytherapy, which is where radioactive seeds are implanted. And that may or may not be combined with hormonal therapy, which is where we manipulate the axis of testosterone production, which directly affects the growth of prostate and, of course, prostate cancer. For your locally advanced disease, which is disease that's invading the seminal vesicles, which is just outside of the prostate, or if we find that there are positive borders after surgery, then surgery can be offered, but usually the patient is advised that they may require multiple modalities of treatment. And again, our radiation oncologist colleagues may become involved, and also our hematologists may become involved in terms of offering either chemotherapy or hormonal therapy. And of course, our radiation therapists would be involved if there's evidence of residual disease after surgery is done.
Yes.
This is where they become involved. Or it can be, the option will be, if we think it's not worth it in terms of surgery with locally advanced disease, then they're shunted straight to radiotherapy,
Yes.
along with hormonal therapy and chemotherapy. For
Right.
your metastatic disease, primarily we offer hormonal therapy. As I had mentioned before, this is manipulating that hormonal axis from the pituitary gland to the adrenal gland to the prostate. And in terms of the production of testosterone, medications are given to stop the function of hormones upstream, which will affect the production of testosterone, and we try to manipulate or suppress or control the growth of prostate cancer via this method. In recent times, there have been a myriad of new medications that have come on stream, some more novel agents that can manipulate the axis, and more modern chemotherapeutic agents, which certainly have aided in extending both the quality and length of life for patients who
Okay.
present with advanced
Yes.
prostate
Happy to
cancer.
hear
But
that.
sorry.
Right.
Mhm.
I have a question though. What
Sure.
kind of impact does the surgery have on the man's sexual life? Sex life?
Sure. So
Yes.
that's actually one of the challenges that's
Right.
faced with surgery, or any treatment actually for prostate cancer. The two more common complications are your erectile function. Up to 50% of men will have some form of erectile dysfunction. Things won't be as they were before. Even though the surgery is what is known as a nerve sparing procedure, which is whereby the nerves which run in very close proximity to the prostate, we actually attempt to preserve them. In some cases, it's not possible. If we think that the disease is extending outside in the region, then we look at life over limb. So,
Right.
of course, the life over the erectile function. But that's one of the common
Right.
complications. And then
Would
other common complication is continence. Um, Again, but that's a bit better. Up to 90% of men after year 1 or 2
yes.
will have reasonable continence. But there's still that 10% that have a bit of
Right.
leaking that
Continence
requires
meaning.
some,
Let's explain that.
Okay, so sorry, continence, just a big fancy word for
Yeah.
being able to control your urine
Yes.
when you want to
Right.
void and when
Right.
you don't want to void, in a socially appropriate manner.
Right. So the impact on the men, is it more to the older men than would be the younger men, or does it matter? The negative
Okay,
impact,
so in
yes.
terms of prostate, oh, the negative impact, yes. So
Of the
yeah, in general,
surgery, yes.
mm, the surgery. Okay, so really and truly, the surgery, apart from being operator dependent, um, the experience of the surgeon, also to a great extent depends on the characteristics of the cancer itself. So,
Okay.
I hadn't gotten into this, but more aggressive disease
Yes.
that's probably extending just outside the prostate or the borders of the prostate may involve, a more challenging surgery, more extensive
Okay.
surgery.
Okay. All right. We
So
don't have a
that
lot
can,
of time, so we have to move on to the other
sure,
area
sure,
because
sure, no
yes.
problem.
Let's talk about October is observed as Prostate
Sure.
Cancer Awareness Month, and how
Uh,
do you continue to maintain this focus and what are you doing now, the Jamaica Medical Doctors Association? What are you doing this year for prostate cancer awareness month? Why do you
okay,
continue to focus?
sure. So, this has been a year to year. Obviously, the month is recognized worldwide, and we've fallen in line with it, especially given the burden that we've seen here. Um, what the Jamaica Medical Doctors Association has certainly done from their members is we've attempted public education. We've attempted to put things out on the internet, on our website. Certainly, raising the awareness, as you can see, I'm in a blue shirt.
Yes,
Um,
yes,
we attempt to bring awareness to the condition in that light. And it's been a slow uphill progress. We have been involved in a couple of the volunteer outreach programs myself. I've been involved in Montego Bay and with Jamaica Cancer Society in terms of from year to year, we will be a part of free screening, which is where we encourage men to come in, via advertisement and otherwise, and we screen them. And the labs are sent through the public system, and then of course we have the appropriate conversation afterwards, pending the results.
right. So you've done all of this work, but
Sure.
men are still dying from prostate
Yes.
cancer. As we wrap this program, because we're almost out of time, what
Sure.
would be your
Uh,
message to the men who are now doing treatment and those who are cancer free up to this point, prostate cancer free? And what would you say
okay.
to them to maintain that health status? So let's look at the ones that are doing
Okay.
treatment and those who are not diagnosed.
Right. So the ones who are doing treatment, I'd want to advise you to be encouraged. Luckily enough, prostate cancer is one of those cancers that there is pretty much treatment at
Yes.
every stage of the disease, even if it's even if we diagnose it when it's far gone, may not be ideal, but there is treatment. I suggest getting into groups, support groups, and so on, which we're trying to develop also in Jamaica. But to keep the faith and be encouraged. Speak with your urologist. It's an informed decision-making process. A lot of the myths that you fear are dispelled once you talk with somebody who is
Yes.
knowledgeable in the area. So be encouraged. To those who probably are not diagnosed, and these are the ones that we have a concern about, men 40 years and older, is really to get yourself tested,
Tested.
screened when you do that male executive test. You know, get screened, ask about your prostate. Your prostate health is important. Health is wealth, again, as I said at the start.
Yes. Yes.
you know and yeah, so that's what I'd encourage. Screening at age
Yes.
40. I had not mentioned, and I'll just quickly mention, the risk factors are non-modifiable. Men of African descent, which is probably up to 90% of the men in Jamaica, we are at risk for aggressive disease, or are increased risk for disease. As you get older, the risk for prostate cancer increases. So, those are non-modifiable factors, and certainly indications for us as men to go in and get tested. It is not as bad as you think,
Yes.
and it can save your life, and that of your household be happier, and overall, for our nation.
Thank you so very much, Doc, for sharing with us. I certainly didn't know that there were so many deaths from prostate cancer, because I thought it was one of the ones that we never had so many people dying. So
No,
thank you for sharing that today. I was happy you could join us for Get the Facts today.
All right, and thank you for having me too. The pleasure was mine.
This has been Get the Facts. Our guest was urologist Dr. Jeremey Thomas, who shared some useful information on prostate cancer. It is Prostate Cancer Awareness Month. Be smart, gentlemen. Get tested today. Early detection can save your life. Until next time, I'm Rose Campbell. Do take good care.